The patient presents with scleritis, simple clinical colitis activity index, and trigonitis. What do you think?
Based on those symptoms, I believe it could be a case of Crohn's disease or maybe even ulcerative colitis.
I'm leaning more towards inflammatory bowel disease or maybe even rheumatoid arthritis with those symptoms.
I think it might be related to some sort of infection, possibly a bacterial or viral one. Maybe even Lyme disease.
No. You're all wrong. It's the epidemiology of syphilis, no doubt about it. We need to act fast. The patient must undergo auriculectomy immediately.
Are you sure about that, Hawks? Auriculectomy is a risky procedure. It could endanger the patient's life.
I don't give a damn about the risks. It's the only way to save the patient. Now, prepare for the procedure. We have no time to waste.
But Hawks, do you really think this is the best course of action?
Do as I say, or I'll find doctors who are less hesitant. The auriculectomy will save this patient, mark my words. I'll take that risk. Now, let's save a life.
Fine, let's do it. But if anything goes wrong, it's on you, Hawks.
Tracy, I need to perform an auriculectomy on my patient. I strongly believe they have an epidemiology of syphilis.
Hawks, are you sure about this? Auriculectomy is a serious procedure.
I've been a doctor for years, Tracy. Don't question my experience or judgment.
I understand, Hawks, but we need to be cautious. Let's discuss this further before you proceed with the surgery.
I don't have time for discussions, Tracy. My patient's life is at stake here, and I know what needs to be done.
Oh no, this is not good. The patient's condition is critical. I need to tell Hawks that auriculectomy was not the correct treatment for the epidemiology of syphilis. How do I break this news to him?
What the hell were you all thinking? You almost killed our patient with your incompetence.
But Dr. Hawks, we thought the auriculectomy was the best course of action based on the symptoms.
I still believe it was the right call considering the patient's history.
I don't know, guys. Maybe we missed something. Let's think this through again.
Missed something. You missed everything? You're a bunch of clueless amateurs who shouldn't even be allowed near a stethoscope. It's clear as day the patient had a completely different condition and you all missed it.
Well, what do you think the diagnosis is then, Dr. Hawks?
You don't deserve to know. I'll take care of it myself. You three are a disgrace to this profession. Get out of my sight. Hey Johnson, thanks for meeting me for lunch.
No problem. Always happy to take a break from work. So, did you finally figure out what's up with the patient from this morning?
Not yet, I'm still working on it. Any suggestions?
Well, have you considered checking their blood work for any abnormalities? Or maybe running a few more tests to rule out different possibilities?
I'll keep that in mind, thanks. Actually, now that you mention it, I think I know what's wrong.
Oh, really? What is it?
It's a rare condition called Blitzer syndrome. I just remembered reading about it last week. Thanks for the help, Johnson. I better go check on the patient now.
Okay. Good job, Hawks. See you later, I guess.
I need everyone's attention immediately.
What on earth are you doing? You can't just barge in here without the proper gear.
This is an operating room, Hawks. You're jeopardizing the patient's safety with your recklessness.
You need to leave right now before you make things worse.
Listen to me. The epidemiology of syphilis in this case is all wrong. I'm telling you, this is a case of Cuff's disease. We need to change course immediately. Tracy, I finally found the right diagnosis for the patient.
That's great news, Hawks. Congratulations on solving it.
It wouldn't have happened if you just listened to me in the first place.
What do you mean, Hawks? I'm confused.
I had a feeling about the symptoms from the beginning, but you dismissed my thoughts.
I wasn't dismissive of them. I was concerned.
You know what? I'm not dealing with this fucking hospital anymore. Consider this my 1 day's notice. I'm leaving after tonight.